Hello and namaste. My name is Ruchi Kamble, and today I'm sitting in Pune with one of our very prominent personalities here. She needs no introduction, but she's going to talk to us about some very important questions, and we are going to explore it together. So, I would like to welcome a gynecologist. She's also an entrepreneur, mother, and a wife, Dr. Sunita Tandulwadkar. Dr.
Hi,
Sunita.
Ruchi.
Hi, thank you so much for joining us today.
Thank you, dear.
So, I have so many questions from you because there are people, they are busy in their lives, they have questions related to fertility and others. So, shall we start?
Absolutely.
All right. So, nowadays we are hearing this word a lot called egg freezing. So, what exactly is it?
Oh, thank you, Ruchi. Thank you for opening up the most important topic. You said it is very well heard, but I think people are not understanding and following it. Egg freezing means freeze your eggs. Unfortunately, in a female, there is a biological clock which is ticking. So at the time of a birth, at the time when you start your first menstrual cycle, and as you age, your number of eggs, quality as well as quantity, both start decreasing. And your fertility chances start decreasing further down. So, when you are at the peak of your fertility, when you have enough good quality and quantity eggs, you should be freezing them. That is called egg freezing.
Okay. And there is one more term called embryo freezing.
Yeah. So egg means only the female gamete. When the lady is married but not planning, she has a husband and she's very sure she's not going to divorce or separate, jokes apart. But then what we do is we take the egg, we take the male gamete, that is sperm, we make the baby and we freeze that baby.
Okay.
Why so? Because embryo freezing has more chances of survival, like 99.5%, as against the egg freezing. And that is why we prefer embryo freezing if she is married. And if she is not married, we do the egg freezing.
Great. Okay. So, who should do it? I mean, the age, what would be the criteria for this?
So, who should do? Anyone and everyone, whether married or unmarried. Both they should freeze their eggs if they are not planning the pregnancy soon. So, one tension that you are aging, your mom, your family friend, your social circle, all tells the girl, you are aging. Aging means what? Your ovaries are aging. Your biological age is aging.
Yes.
So they should freeze their eggs so they have a freedom to marry at their will. Similarly, even if you are married, but because of some other reason, you don't wish to plan the pregnancy. So maybe you are married at 30, 31 at right time, but you decide that we want to plan the pregnancy at 35. You should freeze your embryos, and then at 35, when you wish to plan the pregnancy, try naturally. If it happens, wonderful. If doesn't happen, you have a backlog of embryos. Now, why, Ruchi, I'm telling you this is we are facing global concern on decreasing ovarian reserve. The ovarian reserve sometimes in 15 to 20% of the woman at the age of 30 is as of at the age of 40. So when you go at the age of 35 thinking, okay, now I wish to plan a pregnancy, there may not be enough eggs remaining. And you might have to just rush for the higher treatment, that is IVF, because when you don't have enough eggs, you should adopt a method by which you have a highest success rate and your time to pregnancy is as short as possible. So I'm in a IVF for more than 25 years now. Previously, if a girl comes at 33, I used to say, don't worry, just wait for another 1 year or so. If you get a good partner, why you want to go through the process? Today, I tell her you are already late because globally, decreasing ovarian reserve is a huge concern. I may not have adequate eggs, and when the eggs are decreased in the quantity, they decrease in quality too. So, right age freezing is important. In today, my practice, at 38, the girl comes. I'm here to freeze the eggs. I feel so bad that she's come very late. At 38, I might have to take out 20-25 eggs to assure that I'll give you pregnancy from these eggs in future. At 30, I may have 8 eggs, they may be enough. So the number of eggs to be frozen also needs to be less when you are younger. It means in one cycle, I can pull out the eggs at younger age. At 38, I might have to pull out 2 times, 3 times to have a sufficient number.
Okay, so when we talk about biological clock, that's real.
That's real. And people are under impression it exists only in female. It exists in male also. Only thing is in male they don't undergo so drastic at 30 to 40 age group, but subsequently they are absolutely also are getting affected.
Okay. So a lot of people don't know how exactly is this done. So what is the procedure of this entire thing?
Okay. So first of all, they should be visiting the IVF consultant. The infertility, it's not infertility. Those who are doing IVF practice, they should be visiting to them because these facilities are available not with the obstetrician or the routine gynecologist. It is only with the IVF consultant. Secondly, they should always visit to the IVF consultant who have this practice going on because they want to use these eggs later. So they should be very confident about their lab facilities, whether their experience on the egg freezing is of decade or so, so that they are assured that it is, frozen in a very well. I'm sorry, but this is very important that every center may not be equipped with such a great facility or may not be experienced enough with such a factor. Now, what is egg freezing? Do we need any treatment? Yes. Women undergo only 1 egg coming out from her ovary in a month. So what we do is in IVF, we give injections from 8 to 12 days so that instead of 1 egg, maybe a couple of eggs come out, and at right time when they are mature, we retry. In a IVF, we fertilize with the sperm, make the embryos and transfer. While in freezing program, either the egg or making of the embryo, and we just freeze them to be used later.
So how long can we freeze embryos or eggs?
You can freeze for as many years as you want.
Okay.
Many times when we freeze the embryo, a lady is undergoing IVF. We freeze their embryo. We gave up 1 baby. They come back after 4 years. They have a second baby. So we can freeze as long as we want.
Okay, great. A lot of people, they think that this procedure is very expensive and that's why they are a little hesitant to, talk about it or maybe to have more information about it. So is this really expensive, doctor?
No, dear. Absolutely not. With this, you are going to get your baby at the back. At the age of 38, not having baby, you will struggle a lot through many failures because success rate decreases drastically after 35 and especially after 38. Here, you are freezing eggs early. So what is the cost needed? The cost of an injection, which may be between 40 to 60,000 rupees, and the cost of egg retrieval and freezing, which may be around another 1.2 lakhs rupees. So within less than 2 lakhs rupees, you can freeze your eggs
For future.
for future.
Sure. So, since many young girls and many young boys also don't know about it, so this topic would be great. They will know that there are centers around us.
Absolutely. And for male, it is just one semen sample they give, they can freeze. Now, apart from this social egg freezing, those who are undergoing cancer treatment, young age, it's not that. For example, I have many patients of CA breast. I at Ruby Hall have very specialized cancer unit. So my cancer specialist keeps on sending me the patients for freezing of the eggs or the sperm. For male partner, so there is nothing, only 1 day delay. So you have discussed with your oncophysician or an oncosurgeon for your treatment. They just send it. We just take a ejaculated semen sample and make 2-3 vials out of one ejaculated sample. Maybe they have given us 4 cc. We just freeze that semen sample, and now the treatment for the cancer is so advanced. So our survival rate has also increased. So it's not that it's end of your life. You freeze your gametes, come back and have the babies. For a female partner, of course, we need at least 2 to 3 weeks in hand, because we stimulate for 8 to 10 days and take out their eggs and we freeze them. So the cancer treatment may be delayed for a couple of days as against the male partner. But we are doing it so routinely, Ruchi, for these cancer patients from ages. And we have several male partners especially who have frozen, came back after 3-4 years. We took out. We do check their sperm. It's not that. But most of the time, those sperms, they are affected. So we take out the semen and we do the IVF for them.
Great. So we are living in a very advanced technology.
Now, the first test tube baby has come out in 1978, more than 50 years now. The technology is safe. More than 10 million babies with this technology are moving across the globe. So, why not to plan your life and by taking the advantage of technology? I'll tell you, a couple of years ago in US, I know the news came out where Apple has given all their employees the egg freezing facility.
Wow.
That was wonderful.
Yeah.
I felt two things. One, probably in India it is much so cheaper, 2 lakhs. When you go to US, it will be 10 times more expensive, this therapy. So they are giving financial aid. They know their women or the girls are working with the time bound, with stress, long hours of working. Everything is affecting their reproductive health. But at the same time, they created the awareness. Their employees, not necessarily every employee, may be aware of egg freezing as an option. So I felt Apple has done a huge job, not only for their company, when the news goes internationally everywhere. The whole world came to know the concept of egg freezing. Many actresses, they do egg freezing because they know their peak of a career. Many women now are taking the advantage in their career path, even from the IT industries. But it's very important, those who are not working should also take the advantage of this.
Absolutely. I also have one question. How will you recognize the right center or right place to go and get this done?
As I said, you should do the thorough check because you are freezing the eggs with the blind faith that you are going to produce the baby out of it. So you need to see 2-3 things. One, how long this center exists. Do they have in-house embryologist? Embryologist means these are the specialized people who work in the IVF laboratory inside. Do they have an in-house, these people who are going to do the freezing of their eggs? It's not the clinician who we do. It is my embryologist at the back end. Third, how long they are doing this practice of egg freezing. If they don't have, they say, no, we are just 2 years, but we are going to start it. I'm not saying they may be bad, but be careful. take a detailed history. You know what happens in India? Somehow people come with so much of a hesitation and they feel glad, oh, doctor has heard us. No, you have all the right to ask these questions to your doctor. It's your biological product you are freezing. It's like you are very sure when you deposit in a bank your money, you want to be sure which bank you are depositing. It's not going to be bankrupt and your money will be lost. It's depositing your biological product. You have all the rights. It's not only the egg freezing we do ovarian tissue freezing also.
Oh,
That's a
great.
completely different aspect, usually for the pathological ovaries. So some other time we will cover it. But it's very important everyone to find the suitable lab where they can. And if they are, Ruchi, since your Instagram is seen all across the country or the globe, everyone should know that there are laws by every country which are different. And they should ask what are the laws about the egg freezing in that particular country. It's very important.
Sure. So nowadays it's easier for you to do it if you take the help of technology.
Absolutely.
So, doctor, we were discussing about cancer patients some time back. I have heard a lot about cervical cancer nowadays, and there is vaccine as well available for this in the market. So, can you please brief us a bit about that?
Okay. So, you know what? In India, the second commonest cause of a woman death is cervical cancer, means secondary to the cancer. The breast cancer top the list, and the cervical cancer is the second most common cause. Unfortunately, or fortunately, both, the only cancer against which the vaccine is available. There is no vaccine for a breast cancer. Okay, so cervical cancer vaccine is available, but there is unfortunately no awareness of it. We give cervical cancer vaccine from the age of 9. So young adolescent girl, cervical cancer vaccine before their first sexual act, they should take it. Because the cause of a cervical cancer vaccine, the most common is a HPV virus. And this cancer is against the HPV virus. So before you have any sexual contact, so 9 to 14 years is the age group which we are tackling. As of now, there is a protocol of 2 cancer vaccine for cervical cancer for these young girls. Now, a lady of 37 comes to me. Can I have her cervical cancer vaccine? Please give me, because we give it till the age of 45. The thing is, she may have already the infection. So we check for her, we explain her. Ideally, you should have taken at young age. Probably you missed the bus, so you are here. No harm, we'll give it, but we will do your screening. So we do HPV virus DNA screening for them. And we ensure that they don't have it. And then we give this. But at the same time, the lady should know the protection is good when they have taken at adolescent age group than in later age group. Now, what is this HPV virus? Ideally, it takes 10 years for a HPV virus and to enter into the cervical cancer first stage or a 0 stage. So you have a long time interval for that. So as a president of Foxy, I'm taking over as a president in 2025. I am going to do this awareness program for an adolescent age group, Do Teeke Jindagi Ke. So you know what, the schoolgirls, even if I feel the government should make it mandatory in a school, the neonate when it is born, everyone knows BCG vaccination, then DPT, diphtheria and pertussis and all these vaccination we have to give, and every lady from rural area to any urban areas, they give the vaccination. Mere baby ka tika ho gaya. Now, if the government puts it mandatory in the project, every pediatrician has to give. So it's a protection. But unfortunately, today, since it's not a mandate, maybe because of several other reasons, when I met many principals of the school, they have a restriction. Without the knowledge, without the consent of the mother or the family, they can't do anything. And they cannot implement because it's not a mandate by government. It is the suggestion for doctors. So somewhere, maybe I think, जैसे पोलियो eradication हुआ ना, वैसे we can think about giving cervical cancer vaccine to every young adolescent age group, so that maybe 2 decades, 3 decades down the line, we will be eradicating probably cervical cancer, or it will be just the sporadic.
Wow, this is great.
It's huge.
Yeah. So, can you tell us again the right age to take this?
From 9 to 45,
Okay.
but we advise younger you are, taken more efficacy and more protection. So as a gynecologist, suppose anyone who delivers with me, I tell them कि if they have a female child, please ensure at the age of 9 to 14 you give her, she may not remember. This age group, they go to the pediatrician. So we are trying to take the help of pediatrician to promote cervical cancer vaccine at 9 to 14 age group.
Okay. And are these vaccines expensive?
You know what, Ruchi? Now in India also this cancer vaccine has been produced. I'm not aware whether it is easily available in the market, but it will be very cheap. It's by Pune Serum Institute only. The cervical cancer vaccination has come. I think they are going to the final stages of clearance or so. But the one which is from outside also, not very expensive. 8 to 10,000 rupees. But if you consider it's going to help you for a prevention in later life, it's a good investment.
Sure, I think this is not
10,000
a
rupees
very
is
big
nothing.
amount. Yeah. Since there are so many vaccines kids and women they take in their entire life, one question would be there: is it safe?
Yeah, it is very safe. Unfortunately, this COVID vaccination, I feel there are so many misconceptions that those who have taken COVID vaccine are facing a lot of problems in life, thromboembolism, heart attack and all. No one has a proof. No one has a evidence of it. But that fear has gone now. Now, when the COVID has come, everyone wanted vaccine. There was so much of a queue because they knew this vaccine is going to protect them from having COVID disease, which is deadly. Same way, cervical cancer is deadly disease. Why you want to die of cervical cancer? Just take the vaccine. This vaccine doesn't cause any complication.
Okay, that's great. And where can a person go to take these?
Any gynecologist, any general practitioner, any surgeons, any pediatrician, they should say, we are aware there is a cervical cancer vaccine and we are here to take. It is easily available in all medical stores.
Okay, because now the awareness is there.
And what I want is the public going and asking their general physicians, I have heard about cervical cancer vaccine and I am here to take. They should go to the pediatrician and they should say, I'm here to take a vaccine. You did not tell me. So the pediatrician will become alert. Now public has become aware and it's very important for me to be proactively telling before they ask me.
Absolutely. So it's easily available.
Very easy.
And you can take it.
And it's very safe.
Okay. So if some women, she got to know about this vaccine in her age of 30. Okay.
When they come, I explain them that only. I do their HPV virus screening and we do give them injections. Okay. Absolutely important.
Okay, great. So even at 30, you can take it.
9 to 45 is the age group we suggest.
Yeah. All right. This is very nice. Thank you so much, doctor, for covering this
Thank you.
very important topic on cervical cancer vaccine.
Thank you, Ruchi. First of all, today the social media has changed. The influencers, I'm so proud of them because they have so many followers and they can reach out. Before we used to say only TV or the radio or the newspaper is the only media to reach out to the masses. No more it is true. You can do so much of a social work as you are doing now here. It's creating, maybe you have helped 10 girls to freeze their eggs or to take the cervical cancer and you prevented. You have contributed to the society.
Absolutely. This is my pleasure to be here with you and exploring these questions. And I hope a lot of you will get help from the OG, Dr. Sunita Tandulwadkar. Thank you so much for joining us. Thank you so much, doctor.
Thank you, Ruchi. And this is the new words these influencers have gone, OG.
But you are the OG.